And I just want to start by mentioning a couple of things that Eric mentioned in his introduction. He said that I'm authoring a report for the Heritage Foundation on this issue. The fact is I've finished authoring it. It is new, hot off the presses, and it is on the table in the back. You're welcome to take a copy if you so desire. And it's called Health Information Technology, the Case for a Sound Federal Policy. Dr. Jason Fodeman, who's sitting over there on the fourth row, worked on the research for the report, and I thank him for his help as well. Another point that Eric made is that none of the Republicans voted for the stimulus bill. It's true, none of the House Republicans voted for the stimulus bill, but it does not mean that support for health IT is not a bipartisan issue. And I know there's a lot of people on both sides of the aisle who support health IT, but what I really want to talk about is that there's different ways to get there. And I think most people are unaware of some of the conclusions that Dr. Lin mentioned. And I think in general, the American people think that health IT is a very good thing, and they hear from politicians on both sides of the aisle about the promise of health IT. There was I don't want to rig tackle too much, but there's a very famous RAND story that's got a lot of notice on this that says health IT will save $77 billion a year. Rick starts to shake every time he hears of it. The study is subsequently debunked, but it has kind of entered the consciousness that there's a lot of dollars to be saved in health IT. President Obama talks about health IT very often, and I don't know how many of you watched the ABC special the other night. I hope not too many of you, because it was deathly boring. I watched it out of professional responsibility, and when they announced 3/4 of the way through that they didn't get to all their questions and they were going to continue it on Nightline, I and the rest of America uttered an audible groan. But nevertheless, President Obama spoke frequently about the 3 ways that he sees to save money. And one of them is prevention, and one of them is getting rid of waste in the system, which would be some kind of more regulations or rationing, or some kind of system where we're making determinations about what medications are available and what aren't. And then the third thing he talked about was health IT. And he didn't really elaborate. It was just assumed if you have health IT, there's going to be savings. And in fact, in the stimulus package, we talked about how it's $20 billion for health IT to encourage doctors and hospitals to adopt electronic medical records. The truth is, the dollar figure is actually much higher than that. The $20 billion assumes $12 billion in savings that CBO did score from, CBO, the Congressional Budget Office, did score from savings for electronic medical records. They said it should be a $12 billion savings, $20 billion in spending. So overall, the gross spend is over $30 billion, over $32 billion in fact, for encouraging adoption. Maybe encouraging adoption, so perhaps mandating adoption is a better way of putting it. So there's clearly a lot of belief and emphasis in the promise of health IT and what it can provide. And I myself am an advocate for electronic medical records. I think they are a good thing if they fit with your practice or with your hospital, and I think they can improve the practice of medicine. That said, I believe that electronic medical records are a tool, not a magic wand. It's not as if we adopt electronic medical records and automatically there are these wonderful savings in the system and our system's not going to have any waste, fraud, and abuse, and suddenly everyone's going to take their medications at the right time. It doesn't happen that way. There's a lot of thought that has to go into it. As Dr. Lin has talked about, there are a lot of hiccups in the system. There are a lot of problems. As I said, I don't necessarily believe the savings that they talk about are going to be generated, neither the $77 billion RAND study nor the $12 billion CBO amount. I also think that the way it is adopted is important. I think you can adopt health IT in a way that works very well in your hospital, but there have been other hospitals that have adopted systems and healthcare networks, like the Kaiser Permanente has tried to have 2 failed adoptions, and it cost them literally billions of dollars, and they had to go rejigger the system. Eventually, they now have a very good electronic medical record system at Kaiser, but it wasn't overnight and it wasn't easy. So I think that is one of the key issues to mention. Another thing I want to raise is that inherent in this notion of $20 billion for health IT is this approach where you're going to take doctors and hospitals and give them, in a 4-year window from 2011 to 2015, money in order to adopt electronic medical records. And I think there are some issues with that. First of all, this notion that if you give doctors money for electronic medical records, they will suddenly adopt them, fails to understand that the cost is not the only problem. There are cultural issues issues. Sometimes older doctors don't want to adopt a record. Some doctors, and the one in my neighborhood, who thinks it is more of a problem to have electronic medical records. He says, even if the government tells me I have to do it, I'm not going to do it. I'll just pay a penalty. I was listening to an analyst this morning who said that he thinks that there's fully 10 to 15% of doctors out there who just are not going to adopt electronic medical records no matter what the government says or how hard the government encourages it. So cost is not the only issue here. But that said, the $20 billion is happening, and or really $32 billion, but the stimulus package is law, and as citizens, we want to see good stewardship of that money, and we want to make sure it's done in the right way. And one of my concerns is forcing adoption in that very narrow window between 2011 and 2015 puts you in a situation where you might have the government kind of pick a one-size-fits-all approach. The government will pick a technology. It's kind of like somebody picking between Betamax and VHS when we're already in a Blu-ray world. I don't want us to be frozen into a technology that is outdated once it's already adopted. So that is one concern I have. I'm also concerned about the lack of a stimulative effect. You have an issue here where a lot of doctors and hospitals are saying right now, I'm not going to adopt electronic medical records until 2011 because I know that the government is going to start paying in 2011. So there's that period between now and then when there's actually an anti-stimulus taking place. People are going to wait, and so you're not going to have purchasing, you're not going to have commerce flowing in this area. So I think that's the opposite of the intended effect, and I'm concerned about that. Another concern I have is CBO has said that you're going to see 45% of doctors and 65% of hospitals adopting electronic medical records by 2019 without the stimulus encouragement. With the stimulus encouragement, figures go up to 70% and 90%. But is it really worth to spend that much money to push forward or to facilitate or encourage something that is really in the works, in the process of happening anyway? It's kind of an expensive way to speed things up, something that's going to happen anyway. Because I think many doctors see that electronic medical records are good and they want to push it for themselves. So that said, in the paper that's available, I have a couple of recommendations now. We're going forward with doing this. We should do it in the right way. I think to the extent that we have electronic medical records, I think we should aim higher than electronic cash registers. Rather than just making it easy for doctors and hospitals to do billing, I think we should really aim for products that encourage improvement in the practice of medicine. Not just have a drop-down menu where you see two options that you can confuse the liver medicine and the cancer medicine, but perhaps even some ways that can encourage you to make the right choices. Not telling doctors what to do, but giving them some options, saying, well, it appears that you have a patient who might have liver cancer. Here are some suggestions. Because right now it takes 17 years from when a therapy is discovered to when it's widely adopted across the medical profession. And if you can have electronic medical records that are linked to some sort of vast database that gives people information about the latest medical technology, then you have the potential of having doctors get more information faster and use their resources better. So that's one recommendation. Second is I really want to urge the Department of HHS, which is right now making these decisions, not to be picking winners and losers. I know there's a lot of pressure from some of the big software developers to say, well, do it so that my program is included, but others perhaps are not. I think it should be as inclusive an approach as possible so that we can get the best technologies and we don't freeze the technology at one point in 2011 or 2012. The third is I advocate for a flexible approach. Right now, we have the iPhone, and people can sort of download apps at any time, and anybody, I've heard about these 8-year-old software app developers who made hundreds of thousands of dollars by coming up with these clever little products. Well, I don't want to belittle the complexity of electronic medical records, but there's a great tradition in America of fantastic products being developed in garages. And I think that we shouldn't freeze things out so that only the most complicated systems can win out, or only the biggest developers can do things. I think there should be an approach as flexible as possible to allow a platform-driven model so that if you see a type of program you want, you can adopt it from there, and then another program adopt from here, rather than having to buy one big package that works for the developer, but doesn't necessarily work for the purchaser. So those are some of my recommendations in the paper. The paper is available online. Trust Eric will put it on their website as well. And